Hi, I'm Dr. Emma Craythorne and welcome to the After Hours Skin Clinic, where your skin questions don't stop when the clinic closes. And in this episode, we're going to be talking about how to have skin like a dermatologist. I am here today with my co-host, Dr. Ellie Rashid. She's my partner in clinic and actually my best friend. Welcome to the show, Ellie.
Thank you so much for having me.
So Ellie is also a consultant dermatologist and her special interest is in regenerative medicine. So she's the one that I'm always going to be asking lots of questions to find out what I need to be doing to keep my skin as good as it can be. Your skin is so glowy, Ellie. Is everyone always asking you about what you do for your skin?
Always. Pretty much every single clinic I do, anytime I go out, any party, as soon as they ask me what job I do and I say dermatologist, they're like, oh, we're going to say your skin looks lovely.
Do you ever sometimes just not say because then you have to go through the entire routine with everybody?
I used to have this thing where I used to make up my job. Like when I used to go out, I used to just make up a different job. I'd have a different persona.
What was your best job?
Just say, oh, just an office job within the NHS, nothing exciting. And sometimes I'd go like completely out there, just make up something really random, like, oh, I've got my own company.
Forbes 30 under 30.
Yeah.
Actually, I'm 50, but...
Kimmy K is my main competitor.
So whenever somebody does come up to you in a party and they say, what is your skincare routine? Because I always kind of think the skincare routine is simple, but actually it can be so long, I think, sometimes explaining to somebody that what I do for my skin is actually not necessarily what you're going to do for your skin because everyone's skin needs are so different. And even whenever I have journalists asking the same questions or you're asked to make a comment on something, it is really difficult when somebody says, okay, well, what do you do for your skin? I was like, well, I do this, but maybe you don't want to do this because that might be the worst thing for you to do for your skin.
Yeah. And also when you think about genetics, like lots of our skin features are down to our genetics and that can't really be changed. But there's so much that you can do to optimise your skin. I'm lucky in that I didn't really ever have much in the way of skin problems growing up. I never really had to see a dermatologist. But there are also things that I did to really look after my skin and make sure that I kept it in tip-top shape even when I was younger.
So before you were a dermatologist, were you as good with your routine as you are now?
So definitely not as good with my routine in that I wouldn't moisturise, I wouldn't always cleanse, I wouldn't always take my makeup off. I've worn makeup since I was about 11 years old, but I was always good with sun protection, always.
And do you think that's because culturally you were brought up that was the right thing to do, to be careful in the sunshine for pigmentation reasons or wrinkle reasons or kind of cultural aesthetic reasons?
Yeah, so my mum, my grandmother, it was the thing that they'd always talk about, you need to protect yourself from the sun. And I do think culturally it was because of skin colour and not getting a tan, Iranian ethnicity. And so that really did rub off on me.
Whereas I was kind of almost the exact opposite of you growing up because I'd say the early 80s in Belfast, it was actually amazing to be in the sun and you were actively encouraged to be in the sunshine and get as brown or as red as you possibly could go. Usually,
but can you go brown?
So brown.
Can you?
Honestly, you would not believe how brown I could go. Whenever I used to spend the entire summer in Ibiza, I would come back after 3-4 months there and be browner than my best friend Ziggy Joseph, you know?
Yes.
I was browner than Ziggy.
Stop.
I swear I would have tanning competitions.
Oh my God.
I'm not encouraging any of this. This is terrible behaviour.
No, we know better now.
Yeah, we do know better.
We know better.
But at the time, it seemed like everybody was doing it. That's what you did, especially if you were from Northern Ireland. I'm sorry if that's being very generalistic to everyone from Northern Ireland, but certainly from where I was from, we would just get as brown as we possibly could. And I probably did that really until my mid to late 20s, longer than I really should have been doing. Probably just whenever I started my dermatology training is whenever I started to pay a bit more attention to, oh my goodness, this might aesthetically look good for me right now, but this is not going to be good for the long term.
Absolutely not. Do you do fake tan now?
I don't even do any tan now, really. I would sometimes, if it was that time around March and you've got to go somewhere and you want to wear a nice short skirt but you don't want to wear tights, then I would fake tan.
Yeah.
Did you fake tan?
No.
Have you ever?
No.
I don't like the smell of it.
Probably don't need to fake tan.
No. And actually, now that I see my skin in the colour that it should be, I actually prefer its own natural colour.
Yeah, it's gorgeous. Beautiful.
But at the time, you don't think that whenever you're Irish. You go, I just want my skin to be brown like everybody else's.
Yeah.
But I think then going into dermatology, I think possibly that actual time of my life is probably what made me then move into the area of dermatology that I specialised in, which is obviously all photo damage, skin cancers, to try and help other people repair the damage that they have done as well.
What one thing did you do or change in your skincare routine after becoming a dermatologist?
Well, I wear my SPF every single day, and I wear it on my face every single day, and I wear it on the back of my hands, and I wear it usually on my chest. Like, for example, today, where this is a slightly lower cut top, I'd wear it on my chest today. That's the one thing that I do every single day.
Yeah, I changed that when I started dermatology. So I used to just wear sun protection in the summer, and then after starting dermatology and realising that actually all year round UV can have an effect on your skin, I now wear it absolutely every single day.
And it's interesting, isn't it? Because there is such a debate about it constantly amongst the dermatology literature, amongst the social media literature, and about some people who are just very anti-SPF in general, you know, almost scaremongering with SPF. And I suppose for skin cancer reasons, we probably don't really need to wear it in the winter time. But in truth, I am wearing it for skin cancer reasons, but really in truth, I'm wearing it for aesthetic reasons.
Yeah, just to keep your skin in tip-top shape. Yeah, completely. I think that's a good reason to put sun protection on, though. Help your skin look younger for as long as possible.
Yeah, I think probably the most compelling study I read was one where if you wear your SPF on your face every single day, then 3 years from the time where you started doing that, your skin will be 23% younger than what it would be if you hadn't have started using it.
Well, that's the thing. Wearing SPF every single day can repair some of the damage that's been done. People think it's just like going forward that you're reducing your risk, but actually there's some repair that happens as well by wearing it every single day.
Yes, and I think that's probably is the most important message for skin aging. I mean, you're a regenerative dermatology specialist, and of all of the kind of injections or lasers or anything that there is available right now, exosomes, stem cells, your number one is still
to put sun protection on every single day. Yeah. Of all the things that can affect the way that our genes are read and proteins are made in our skin and repair is done, the number one modifiable thing that you can do is to wear your sun protection every single day.
Yeah, I completely agree. And that should just be the mantra of this. Just put your SPF on your face every single day.
Make it the tagline.
But even whenever you think about not just aging, so, 10% of our population have rosacea. Another high percentage, depending on which group you're looking at, have melasma, which is a condition of, increased pigmentation in the face. And the number one treatment for these is protecting the skin from more ultraviolet damage. So there's your SPF again.
Yeah, 80% of rosacea patients, sun UV is a trigger for them, even if they don't realise it themselves.
What is your SPF of choice?
So at the moment, I'm using the Trini London, which I'm really enjoying, and then ultraviolet Dermineral SPF, which I'm loving as well.
Is your Trini one the purple one?
Yeah.
Yeah, I like that.
Gorgeous. And it smells nice.
It does. I just cannot see past, what I'm going to say. The La Roche-Posay Anthelios UV Immune 400. I feel like a bloody broken record.
You've got shares in Anthelios.
I actually don't have shares in Anthelios. I should have shares in Anthelios.
Oh no.
Even my kids make fun of me. They're like, you always just say two things. La Roche-Posay Anthelios UV Immune 400 or La Roche-Posay Lip Carbon AP plus M.
They are good products.
We're going to take a quick pause for some ads, but don't go anywhere. We'll be back with more of our best advice for caring for your skin like a pro.
Back with you in a minute.
Okay, so SPF is our number one thing. So that person's come up to the party. They're asking us, what do we do for our skincare routine? And we're trying to be fairly generic. SPF is number one.
Yeah, perfect.
What's number two?
Number two for me is a vitamin A derivative or tretinoin at night.
Yeah, I agree. I actually just say just the tretinoin.
Yeah, the tretinoin has to be prescribed. So perfect. If they can get tretinoin, that is the best. But if you can't, then retinol or retinal. And if maybe some people want to start with that and then move on to a tretinoin. But yeah, by far, tretinoin. It didn't make such a difference.
So I see that glow that comes at 6 weeks of using it. So
I see it sooner than that.
You get it quicker.
I swear to you. Like one application, I'm like, my skin looks better already.
That's the moisturiser, Ellie. This doesn't physically happen.
I swear, I think I haven't seen in that. I'm like, oh, this is amazing. This is probably placebo effect.
No, but that's because you use the clearer one. And because in the clearer one, there's so many of the lovely ceramides and shea butters and peptides. So that's why you're seeing that effect.
Gorgeous.
And actually using your SPF in the morning and then your clearer special at nighttime would probably be two really good pieces of advice to give to somebody at a party.
Key, absolutely key. I've been using clearer for about 18 months now, and it's completely transformed the way my skin is. Before that, I mean, we've got access to everything, don't we?
Everything. I mean, everything. Like
everything.
Everything. Devices, peels, masks, everything.
Yeah. And I've never been able to tolerate retinol or retinol ever. Always made my skin flaky and sore and burny. And so I was like, there's no way I'm going to be able to tolerate tretinoin, which is the more bioavailable form of vitamin A. And all the clinical evidence suggests that it is the best ingredient in terms of skin regeneration, exfoliating the skin, improving the skin cell turnover, repairing fine lines and wrinkles and skin aging. But I was able to tolerate clearer beautifully. We might talk about clearer from time to time. It might come up.
Yeah, if we do talk about it too much, we must stop each other.
Yes.
Okay, so we're doing our SPF as our number one piece of advice at the party. At nighttime, clearer special.
Yeah.
That's it.
Done.
Episode finished.
Episode over.
What else would you say?
So an antioxidant in the morning. So I tend to use vitamin C. What's your go-to vitamin C? Do you use vitamin C?
I do use the vitamin C. And my number one go-to is the SkinCeuticals.
I know.
From L'Oreal. Again, I don't have shares in the company.
It's just expensive. That's the only thing, but it's lovely. But I do think there are other good options for vitamin C. So if we think about environmental factors that can have a negative effect on our skin, so things like pollution, then using an antioxidant in the morning is perfect to try and reduce the effect of some of those environmental stresses on our skin. And so, yeah, vitamin C for me is the top antioxidant ingredient. It usually comes in a serum, so you can put it on in the morning. Remember, SPF is our last step of our morning skincare routine.
And I think the reason why the SPF is the last step is because that's all about creating this film. So the film will sit on your face. So essentially an SPF is just a combination of filters in a lovely film. And the most important
thing...
SPF. No, gosh, we're like a broken record. But it's about that lovely film and ensuring that film's in place. I heard something really interesting the other day that actually putting vitamin C on at nighttime is counterproductive.
Oh, fine. Yeah, I thought you were about to say that you should do it.
No, you shouldn't.
Yes, morning, yes.
Yeah, only in the morning because it said it lasted around about 8 hours.
Yeah.
And then a lot of people were then putting it on in the morning and then topping it up again in the evening. But actually that is a bad thing to do. And it's not just, it's not going to be effective, it's actually counterproductive.
Okay, I didn't realise that, but I knew that it was just in the morning. Then the other thing, some people break out with vitamin C, don't they? But it depends on the formulation of the vitamin C. So if ascorbic acid doesn't quite suit people, then you can use one of the other vitamin C derivatives that are a little gentler. Yeah,
I think as well, they have to be in quite a low pH, don't they? That it's quite acidic, the ascorbic acid has to be in. And I sometimes think that can be a little bit irritating for people's skin.
Yeah. And also remember, like when you leave it out on your dressing table, UV light denatures the product.
Yes.
And then it goes that brownish colour. It's a funny story. I gave my mum some vitamin C serum. She'd been using her SkinCeuticals one. And then I gave her like a new bottle of SkinCeuticals vitamin C. She sent me a message going, what's this thing that you've given me? It's gone off. What are you talking about? She goes, well, my one's lovely and brown and gives me a delightful glow to my skin. You've given me a white formulation. I was like, no, Mum, the one you've got has gone off. You've had it for about 25 years. The one I've given you is fine.
Yeah, it's not doing anything now. It was one of those things that my kids had at school where, they have to go in and do some kind of experiment. And I think my daughter was probably in year 6 or something. So that's about 10 years old. And her experiment was on antioxidants. And so she took in an apple and took in the apple to school, chopped it up, and then put the SkinCeuticals antioxidant on one side of the apple and then just left the other one to show the browning of the apple. And the SkinCeuticals obviously stopped the apple from browning. Yeah.
Amazing.
The teacher then called to say, how can I get some of that? Okay. And so, moisturiser?
Yeah, I mean, I tend to use a moisturiser, particularly in the winter. But in the summer, I normally can get away with just using my sunscreen. It's usually moisturising enough. But yeah, in the winter, I'd use a moisturiser.
And anything special with cleansing? We're still at this party telling this person about how amazing your skin is. So
yeah.
So from now on, you don't have to keep talking about it. You can just say, oh, just listen to my podcast.
Yeah. I'll send you the link.
Yeah.
Cleanser. Yeah, so before starting dermatology, I used to be like, oh, it doesn't matter what you wash your face with. Like, who cares? Just wash it with any old thing. But one thing I definitely didn't like washing my face with was like a soap. Just that feeling it left like on my skin, just
the
horrible.
squeak.
Oh, horrible. Yuck. Ick.
It's almost as bad as the fingers going down a chalkboard, that squeaky skin. Ooh.
Yeah.
Yeah, so I think that is the most important thing. And I tell almost everybody, just a gentle cleanser.
Yeah.
Go to Cetaphil. Cetaphil Gentle Cleanser is, that is probably one of those things that generically you can say to most people and they would get on well with it.
Most people can tolerate it. Yeah. Not even tolerate it, like it. Yeah. Like really enjoy using it. Yeah, it's a nice, lovely cleanser.
Okay, so number 1, get your SPF. Number 2, get your Clearer Special from Clearer. Number 3,
an antioxidant.
Cetaphil Gentle Cleanser to wash your face. And if you need a moisturiser, I like La Roche-Posay Lipocarbon AB+. No. Other brands are available, just not in my house.
Do you use like a peptide moisturiser?
I don't, no. I do like the PTOX one, but no, I don't.
Yeah.
Do you use that one?
No, another Trini London one that I got sent, but it's the peptide moisturiser. But I like it. It's quite rich, so I use it like a night cream.
Yeah. Sometimes for me, it just gets so many steps and there's always a reason for adding in another step, isn't there? Because you could do this or do that. But I just think that if I add in too many things, then I'll suddenly not do anything.
Yeah.
So I think if I just, in the morning, I wash my face, put on my antioxidant, my La Roche-Posay, and then my SPF. That's enough steps.
Yeah, that's perfect.
And then nighttime, wash my face and Clearer Special.
Done.
That's it.
Tick.
And in terms of like the next step on, people will then say, well, what do you do in clinic to your skin? What else do you do to get the glow? I would say
Are you going to give away all of our secrets?
Absolutely
not.
What are you
doing? No. I was like, what's she doing?
I was actually rhetorically asking the question.
Yes, no, I was nothing. Say, that's all we do and we look like this.
Which would you pick? You can only pick one, okay? You can pick the other stuff that you can do in clinic and you're not allowed to do any of the skincare routine we just talked about.
Yeah.
Or you can do the skincare routine we talked about and not do anything in clinic.
So this is what I tell my patients and it's the advice I stick by. There is no point in doing these one-off treatments in clinic like a hydrofacial or like getting your Botox done or having these biostimulatory injections if you haven't nailed your skincare routine. I mean, it's pointless. You're just going to have to keep doing it over and over again. But if you get your skincare routine right, then you can complement it with some of these in-clinic treatments.
Yeah, I agree. But you've got to pick one. In-clinic treatments or at-home skincare?
At-home skincare routine, 100%.
Me too. It wouldn't.
I think I'd feel unwell if I didn't put my sunscreen on before I went out. I'd honestly get anxiety.
I don't think I could sleep without putting my Clearer Special on at night time. Couldn't.
Could I? What would I do? Just walk around with dry, inflamed skin.
Can't have that. No one's coming to you at the party.
No one.
Anything we have talked about today will be in the show notes. And we have started to touch on a few of these subjects like SPF and retinoids, and we'll do a deep dive in these in upcoming episodes. Thanks so much to Ellie for joining me.
An absolute pleasure. I've loved every second.
And thanks to all of you lovely people for joining us. If you haven't already, take a moment now to click on the subscribe button so that the next episode will pop up like magic in your feed. As we're a new podcast, this is what really helps us reach more people. And it also means that you won't miss an episode. So until next time, lovely listener, take care of yourself and your skin. And we'll see you next time on the After Hours Skin Clinic. This podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.